Good morning. Welcome to Activating with Barb. My name is Barb. I'm a physical therapist assistant and also a licensed massage therapist. I work with the team at Therapy at Home, and our passion is to inspire seniors like you to live happier, healthier lives so that you can age successfully and independently with a positive attitude. So together we can create possibilities as we get older, but we get better. So today I'm going to be talking for a few minutes about frozen shoulder. You may have heard of this condition. It's a fairly common condition. It's a progressive condition, so it generally gets worse and worse until you get treatment, but it's not life-threatening. Still, it can really affect your quality of life, not being able to reach over your head or only do the things that you normally do in your daily life. So I'll talk for a few minutes about that, so some risk factors, and some treatments. So this information is only for educational purposes. It's not meant to diagnose a specific condition or treat a specific condition. If you have questions about your own body, make sure you check with your healthcare provider. So frozen shoulder, also known as adhesive capsulitis. There's a capsule in your joint, and that's the part that's affected when you have frozen shoulder. So it's fairly common. It occurs usually in people when they get to their 50s and 60s, and it's more common in women than in men for some reason. It sometimes happens after a surgery or after a stroke, sometimes after breast surgery for women, where the joint was immobilized for a while and then it gradually gets painful and the range of motion decreases. So the primary treatment for this condition is physical therapy. Most of the time people get physical therapy and it gradually improves over time. Very infrequently, once in a while, they might use corticosteroids or numbing agents because of the severe pain, or sometimes even surgery. But that's not the most common way it's treated. So there's 3 stages of this condition. First stage is the freezing stage, where you have increased pain in that shoulder, so you really don't want to move it as much, and gradually you used to be able to reach up here, then you can only reach here, then eventually you may not be able to hardly lift it at all. So there's increased pain and decreased range of motion, and this might last for weeks or months. The second stage is frozen, and that is when there's much less pain, but you really just can't move it at all. It just doesn't want to go. And that stage can last about 4 to 6 months. And then the third stage is the thawing stage. That's where you're gradually getting your range of motion back. So slowly over months. Sometimes it can even last for a year or more, but gradually over time it improves, and eventually you're back to reaching all the way over your head. So it's a very painful condition initially, but not life-threatening, and it's very, very treatable. So really important to not worry too much about it, but just be aware of it. So there's risk factors. There's certain conditions that increase your risk of getting this frozen shoulder. So we should be aware of those things. 1 is diabetes, 2, cardiovascular disease, 3, tuberculosis, 4, Parkinson's disease, and 5, hyperthyroid disease or hypothyroid disease. So any diseases where your thyroid organ is affected can increase your risk for this frozen shoulder condition. So it's good to be aware of that, and just notice if you start having pain in your shoulder to get that checked out so you can get treatment and recover as soon as possible. So how is it treated? Physical therapy. Lots of different techniques that are used. One of the simplest ones that happens usually in the early stages are called pendulum exercises. And that's when you lean over and you just use your own body to move your arm around. So I'm using my body, I'm not using muscles, and I'm swinging side to side and back and forth, and even swinging in a circle, using my body to move that arm. Very gentle, gets the synovial fluid moving in the joint, really gentle and hopefully not painful when you're first getting treatment for that. Another thing they might use is wall walking, where you use a wall and you use your fingers to slowly walk up the wall to gently stretch out that shoulder and get a little bit more range, getting it a little bit higher. Wall walking. Another thing they might use is a stick or a cane, where you have that stick in your two hands and you're using the stronger or the one that isn't frozen to help lift the one that is frozen. And you can gradually increase that. You can go side to side. You can go have it bent and do a rotation going out that way, and you can go in using that stick, pulling and in all different directions. So a stick can be really helpful in helping increase that range of motion. Another thing they might use is a pulley system, where there's two handles and there's something looped over a doorway. You use that good unaffected arm to lift the one that is limited. So if you can imagine, one arm pulls and lifts the other arm. That is really painful and limited in the range. And another thing they might use is an arm bike. So a bike that sits on a table, so there's pedals. Again, you have that unaffected arm helping the other one, the affected arm, move in different directions. So lots of different techniques that are used to treat frozen shoulder. Hope you don't have to experience them, but very common condition that is very, very treatable. So that's a good thing to know. Very treatable as long as you get help and you get some exercises with a physical therapist. All right, so for next time, we're going to be talking about our relationship with food in our next video. You might not know you have a relationship, but we all do. It could be good or bad, but we want to be able to enjoy our food because we need food to nourish our cells, nourish our bodies, and keep us healthy and strong. We don't want to feel guilty and when we eat, and we want to feel good about it. So before we start exercising, if you haven't done any exercise for a while, make sure that you check with your healthcare provider and get the okay. And if you start exercising and you have any severe symptoms, chest pains, shortness of breath, dizziness, make sure you stop and get checked out. Okay, let's get moving. We always start with a warm-up. So a good way to warm up is just to bend your knees and shift side to side. So even though it looks like not much, I'm activating my quads, I'm activating my feet and my ankles. So we've already got several joints involved, a little bit in the hip joint, just shifting side to side. And then we can add a little reach, gentle, we're breathing deeper, getting that blood moving, reaching, and let's go a little side to side, rotating around the spine, just getting that blood flowing. Rotate and rotate, reaching up and reaching up. So I'll try to keep in mind that frozen shoulder. Even though you might not have frozen shoulder, a lot of us as we get older just don't have the same range that we used to. And we want to keep our range of motion as long as possible. We want to be able to reach to those high shelves and to the low shelves. So let's reach down, shifting side to side, one foot and the other foot. So you're rounding, gradually working your way up, reaching, kind of wiping the air. Good job. Wiping the air and reaching higher. So now we're feeling it probably in your ribs a little bit. Reaching and reaching. And work your way down. Very good. I'm feeling in my hips and my lower back. So you're shifting side to side with your legs, but you're also reaching with your arms and shoulders. Very nice. And you get all the way down. I'm feeling it more in my hips. And then stay at the bottom and then slowly roll up. So lengthen your back. You're kind of pulling down with your hands, pulling up with your back, and reach it. Good. All right, let's get the quads moving with some kicks. Kick into the front. So you're extending your knee, but you're not bending at the hip, at the waist. So anytime you isolate that hip joint, the rest of your body is working, the core is working to maintain your balance. Good work. We're kicking to the front. Kick into the front. And let's kick across. Activating those glute muscles a little more. Kicking across. Good work. And deep breathe. In through the nose. Out through the mouth. Kicking across. And kicking to the front. Let's get the arms going too. We don't want to only work one body part. We want to work as many muscles and joints as possible. So swing, step and kick. And then we'll go side to side. So anytime you go side to side, you're using those hip abductors. If you put your hands on your hips, you can actually feel the joint moving. Really important to get your hip joints moving in all different directions. And when you go side to side, you're using the hip abductors, which are really important for balance, which a lot of people think as we get older, our balance is going to decline. Doesn't have to be that way. If we keep working on it, it stays strong. Those balance reflexes, just like muscles, if you work them, they get stronger. So side to side, and adding a reach. Adding a reach. So we're getting the core involved. Side and reach. Reach and reach. Still warming up. Good work. If you want to add a little more effort, just bend your knees a little bit. A little bend. Just that little knee bend really increases your effort. So get your heart rate up. You get more benefit for your cardiovascular system. If that's too much, then just do a tap without the bend. You decide. This is your workout. You decide how hard you want to work. But it's always good to challenge yourself so you get increased benefits. All right, now that we're warmed up, we're going to do a figure 8 with our shoulder. So gentle, circle one direction and the other direction. Gentle, getting bigger, sweeping in the front and sweeping behind. Big circle, big circle. So this is a great exercise for shoulder range of motion. You're moving it in all different directions. Turn your thumb down and up, down and up. So you're moving your shoulder, but it's attached to your back and your ribs. Getting bigger and bigger. So I'm feeling it in my lower back and my upper back. Very nice. And we'll switch arms, starting small. Circle in one direction and the other direction. You can lean on your leg for some support. So we're rotating our shoulder, but we're also rotating around our spine, trying to increase that range of motion in our spine. We want to be able to turn and look over your shoulder without too much trouble. Getting bigger and bigger. Reaching way back and closer to the floor. And let's do both arms together. So elbows back and forward, rounding, arching and rounding. Arching back and rounding. Circle back. So here you're pushing your arms in one direction, your back in the other direction, really reaching, and then you're pulling your elbows back, trying to get a little arch in your back. I can feel lots of little crunching noises, and my back is really loosening up now. I hope you're feeling the same thing. And if you feel like you're hardly moving, that's perfectly okay. You might start with very small motions, but gradually your body will give in and you'll be able to move farther and stronger. Great job. Trying to get those circles bigger and bigger. Moving in one direction and then moving in the other direction, pulling your elbows back. Really good for your posture, opening up your chest. All right, let's do some leg lifts. So if you need a chair for balance, have your chair nearby. And we'll start with a flex foot, lifting up in the front. We want to work the whole hip joint. Strong hips will take the pressure off your lower back. We don't want the back to do the work, we want the hips to do the work. So flexed foot, lifting up, keeping your core nice and long, pulling up, and then we'll go to the side. So your toe is pointing forward, you're not turning your knee out. That makes sure that you're using those hip abductors. Doesn't have to be a large motion. You're still activating those abductors. Good work. And we'll go for 8, 7, 6, 5, 4, 3, 2, and 1. Let's switch sides. We're going with a flexed foot, toes pointing up, knee is perfectly straight to activate that quad, and lifting up, lengthening, pulling up tall. Good job. Keep it going. Not a big motion, but we're activating the quad and the hip joint, the hip flexors. And then to the side. Toes pointing forward, knee is straight, and a little lift to the side. So anytime you're doing an exercise where you're standing on one leg, you're strengthening that hip. You're strengthening the joint, strengthening even the bones are going to get stronger just by that weight bearing, standing on one foot. Good work. Very nice. So really strengthening the hip in all different directions. Let's switch again. This time, knee is bent, and we're going to lift up in the front. So we're working the inside of the thigh. Doesn't get worked very much, but still really important to support your knee. And another way that supports your hip, strengthening the hip in all different directions. Good work. And we'll switch. So other knee, legs out in front, bend the knee out to the side, and then lift. It might feel kind of awkward. These aren't muscles that we work very often, but they're very important to support your knee and to give you strong hips in all different directions. Lifting for 8, 7, 6, 5, 4, 3, 2, and 1. So we lifted front, we lifted side, we bent the knee. Now we have to go to the back. So use a chair if you need support, and push your leg. You can have a straight leg and just lift it a little bit to the back. Really working the glutes. So it's trying to stay up tall and not bend forward. It's a small motion, but do your best to keep your legs straight and lift it straight back. We've done this with a bent leg. Today we're doing it with a straight knee. Really feeling it in those glutes. And we'll switch. So leg is straight, slide it back, and then lift. Many people have trouble keeping that knee straight, but do your best. So you're just lifting a little bit. And you should feel that activation here. You can put your hand on it, and you'll feel the muscles contracting. These are the hip extensors. Really important for climbing stairs. Good job. 8, 7, 6, 5, 4, 3, 2, and 1. Good work. All right. We'll move on to arms. We did a bunch of hips. Now we'll do some arms. So arms straight out and to the sides and push back. For 8, 7, 6, 5, 4, 3, 2, and 1. Now come in and go on a diagonal. So you're getting a little bit different part of your shoulder. 7, 8. Come in and the other diagonal. 8, 7, 6, 5, 4, 3, 2, 1. So your arms are in line with each other. Your arms are straight. Now we'll just go back to the middle. So pull back and straight. Really working those shoulder joints and working your posture. So we're stretching out the pectorals and we're strengthening the traps, the upper shoulder muscles. So in and out, in and out, in. A few more, doing good. And relax. Now we'll work the triceps. So pushing to the front and pushing to the side and pushing down. Good. Front, side, and down. Front and side. Pushing the heel of your hand away from your body. So that gives you a stretch in here. Side and down. Now let's add some legs. So we're working multiple muscle groups. Just point your knees out. Keep your knee over your ankle. Don't let it go past your toe. Turning your knees out to activate the glutes. And then we'll do some more pushing with the arms. So pushing forward, forward, pull back, reach down, pull up and up. Side to side, pull in and back to the front. Push down, pull up and push out. Push front, pull back, pull down, push down, pull up. So when you're pushing down, let's do a few of them. You should feel a little stretch in your lower back. Push down, push down, push down, push down. Just a few more. Good work. And we're also working the core. So working this core, all these abdominal muscles, pushing down and down. Push down. And then push behind. That's a hard one. Working your balance some more and also working the core. And because we have our knees bent, we're working our quads. So multiple muscle groups. We want to get as much out of this workout as possible in the shortest amount of time. pushing behind. If your legs get tired, just stand up, shake it out, and start again. Good work. Couple more. 4, 3, 2, and 1. Stretch it out. Reach up. Good, good. Shake out those legs. And we'll do a little lunge to the side for a little more core work. So bend one knee. You can use that for support. Reach out as far as you can. And lift up. Reach, reach, reach. And lift. Reach. And lift. So here we're loading up that leg. Loading up the core. And then you lift in a straight line. You don't want to use your hips to come up this way. You want to use your core to lift your whole body. So reach and lift, reach and lift. One more, and we'll switch sides. Good job. Turn your feet so you're pointing the other direction. Bend your knee. Make sure your knee stays over your ankle. You can lean on it if you need to. And we're going to reach as far as you can. Long line from your toes to your fingertips. And then come up. Reach. And come up. Reach. And up. Reach. And reach. Really working the core, working that quad. So we're lengthening and strengthening. Good work. When you lengthen the muscles while you strengthen them, it helps keep your joints more mobile. If you shorten your muscles while you strengthen, it could kind of jam up the joints and actually lead to increased pain. So we want to lengthen and strengthen. And pull 3 more. Pull 2 more. Pull 1 more. And up. Good job. We worked the legs and the hips. Let's stretch them out a little bit. So I like to use a chair. You can put your foot on the ground, but I think a chair is very useful. So you can turn your knee in and out to mobilize that hip joint. When you have a blockage in your hip joint, it can lead to increased back pain. So we want to keep the hip joints as mobile as possible. In and out, then straighten the knee, toe pointing up and bending from your hip joint. And coming forward, feeling a long stretch down the back of your leg. You can go up and down with your toe to stretch out the calf a little bit. And breathe. Up and down. Then you can come forward. So then we're stretching the back leg. You should feel it in the front of this hip joint. So we're stretching out the hip flexors. And then pull back. Bend that bottom leg to stretch out the hamstring. And then come forward. Stretching out the hip flexor back here. And back. Good job. Then turn your toe out and come forward. Then we're stretching the outside of this leg, getting the IT band. That's a bunch of ligaments that can sometimes be tight. They're supposed to be tight to support your knee and to stabilize your knee, but if they get too tight, they can actually cause some knee pain. So you want to have a little bit of flexibility there. So toe is turned out, knee is straight, bending from the hip joint. She'll feel a nice stretch along the outside. Can be kind of intense. All right, let's switch legs. So other leg is up, turning the bent knee in and out to loosen up that hip joint. And then straight leg, toe pointing up, bending from the hip joint to stretch out that hamstring. Always tighter on one side. Everybody's got one side that kind of gives them more trouble. This side is definitely tighter on me. And you can go up and down with your toe. Good work. Then we're going to come forward. So then you'll feel a stretch in that back leg. Trying to press your heel down, then you'll get a calf stretch as well, but mainly it's the front of this hip joint that we're stretching when we come forward. And then push back for the hamstring, bending the standing leg, coming forward, feeling the front of this hip, the hip flexors, and back, getting hamstring. Good job. We didn't do much for the calves yet, so let's do some up and down. So feet are about hip width and going up, and then slowly down, up and down, up and down. You can try to reduce the pressure on that chair that you have to work your balance reflexes some more. Really good on your balance this way. I'm just trying for one finger. You can try no hands. Really strengthening the ankles and the feet. All important for balance. Try not to let your ankles wiggle. Keep them nice and strong and steady. And let's do a couple with one foot. So lift up one knee, go up and down, up and down. So now you're really loading up that calf. And 4, other side, lift the other leg up, going up and down, 2, and 3, and 4. Good job. Now we got to stretch out those calves that we worked. So straight leg back, trying to press your heel down, stretching out the calf. Nice deep breath. Then if you shift your weight back, that stretches the Achilles and the shorter calf muscle called the soleus. And forward for the long calf muscle, shifting back for the short calf muscle. And we'll switch sides. So leg reaches back, try to press your heel down to stretch the calf. And then shift back for the short calf muscle. And forward, and back. Good work, we're almost done. One more time forward, and shifting back. And we'll finish up with some more shoulder work, reaching your elbows back and up, and reaching forward. Pressing with one and pressing with the other. And going up higher and higher. Reaching up, and then back and forward, making circles. Back with the elbows, forward, back, and forward, back. So working that shoulder joint. So pressing back and pressing back. 8, 7, 6, 5, 4, 3, 2, and 1. Good work. You can reach up and press that shoulder back for a stretch. Reach up with the other and use your other arm to press it back, really lengthening out. Then you can do with a bent elbow, pulling across. Bent elbow, pulling across. Good work. Let's take a couple nice deep breaths, reaching up and blow it out. Reaching up and blow it out. One more time, reach up and blow it out. Thank you for joining me. Till next time, be well, stay strong. Bye-bye.